as you see, we are not just about medicine in an eye. We are about humanity, from health camps and vaccination camps to disaster relief. IMI UK is active where help is needed the most. We empower future doctors. Our 72 plus projects span education, personal development, and professional development, humanitarian aid, and health services. And we offer membership to medics and non-medics. Like there are certain things where the non-clinical people or professionals can help us as well, like technical staff. So this is the membership fee. It's not that much. Like monthly, you have to pay £10, and then if you go to yearly subscription, it takes around £100 a year. That's not a lot for the work we have been doing, we have been offering. And there are certain benefits of the membership that you, with regards to your personal and professional development. And then you would be involved in serving the humanity with us. These are few links that, as I showed you, that how easy is it to get involved, whether you want to volunteer, learn, lead or connect. IMI UK is your gateway to meaningful change. So let's begin this journey together. Because saving one life is like saving all of humanity. Here you can see, if you want to visit our website, it's imimedics.com. Then you can follow us on social media via Instagram, Facebook, LinkedIn, or YouTube. Or if you like to contact us, there is an email ID, and then I have mentioned the contact details of IMI UK President at the moment, Dr. Waji Khwaja. That's his direct number. And then the other number is for IMI UK Europe Secretary, Sayyida Yusra Rizvi, and her number is mentioned here as well. We can give you the details later in the program if someone is interested. So that's all about IMI and what we do. Thank you so much for your time and thank you for listening.
Thank you very much, Dr. Fatima. It was an amazing presentation covering all the work, mostly not all the work possibly, but by and large, what Novembet has been doing, serving the whole community. Not just the community, rather several countries beyond borders and serving everyone who is in need. So amazing journey shared with us. Thank you very much. So before we begin with the further presentations by different students and healthcare professionals, I would just like to make you all aware that we have raffle tickets at the registration desk. I would encourage each one of us to please go for the raffle ticket. It's a £2 ticket where we'll have a raffle draw at the end, and you'll have a chance to have free Invisalign consultation by Pearl Dental Clinic from professional orthodontist. And we have teeth whitening services available there, which you may win in the raffle draw. We have electric toothbrushes and water closer. So a lot to go for. So please go ahead and grab your raffle draw ticket, and let's proceed with the program. So I would like to now invite Mohammed Abbas, who is a first-year medical student from Manchester University, and we are really thankful for him because he has to catch a train right after this and has come all the way from there to just enlighten us and help the younger population here who are seeking any health medical related fields in the future. So thank you very much. Let's listen from him.
Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. As Auntie said, I'm a first year medical student at the University of Manchester. I'm going back to Manchester straight after this as well. So that'll be good. So it starts with your GCSE. So it starts with GCSEs. You want to be aiming for the highest grades, so your 7, 8s, and 9s, especially in your Englishes, your maths, and your sciences. That's because medicine is such a competitive course, so the higher your grades, the better the chance that you have. And especially for some medical schools, such as Oxbridge, Cardiff, and Newcastle, your GCSEs are weighed quite a lot, especially for Cardiff, where they give it based on a merit system. So the more lines that you have, the more points that you have, and the more likely you are to get an offer. But it's also good because it just shows medical schools in general that you have the consistency, your resilience, and the ability to manage intense workload. And that's especially important when it comes to medicine because there's so much to do. So from GCSE, you're just building the habits and displaying to medical schools that you're capable of understanding all the content and handling yourself. That moves on to A-levels, where most medical schools will require 2 sciences. Most of the time it's just chemistry, biology. You can also do maths, physics, or further maths as well. Like those will also count as a science. The typical offers are 3 A's to A-star AA. So extremely high grades, but medical schools expect you to be able to handle yourself, like I said before, and achieve the top grades. And I also said choose subjects that you enjoy to stay motivated, because A-levels are so different from GCSEs. Because they're so difficult, you want to be able to do something that you enjoy. I particularly enjoyed chemistry and biology. That's why I thought medicine was a fit for me. But also doing a third subject that you enjoy, something like psychology, economics. It doesn't really matter what your third subject is, just make sure it's something that you can enjoy and that it doesn't feel like you're working a whole lot, so you can avoid burnout as well. I would then say your work experience. So I would say aim for 3 different placements. It doesn't really matter what those are. I did 2 hospital placements and volunteering in a care home for about 4 months. But I know other people that did GP placements. They also went into care homes. They did different types of volunteering. As long as you have exposure to the healthcare field, medical schools aren't particularly looking for hospital placements because they know that sometimes they can be quite difficult to get. Which is any exposure to the healthcare field, they just want that, and it's more about what you have learned and what you can reflect from your placements, and then I would also say record any memorable experiences so that you can refer to them later on in your personal statement, and just make sure to protect patient confidentiality. So just use very general terms, just describe the experience, but don't have any patient identifiable data. This moves on to the personal statement. So your personal statement is, I would say, just show why you want to study medicine. Be genuine in your writing. because medical schools can very easily, they breathe through thousands of them year on year, so it's very easy to tell when someone isn't being genuine in why they want to do medicine. And I would say use your work experience before, so this is why it's very important to record it, to showcase the key skills that you saw the doctors use or you saw medical students use. I would say reflect on what you learn, make sure that the reflection takes up the big majority of your personal statement. You're not just describing what you did throughout your time, you're actually describing what you learned from it, why that inspired you to continue doing medicine, and actually apply to medical school. And I would also say mention your academic curiosity. In certain cases, if you've read certain books, if you've read research, if you've done competition, if your school has a medicine society or a medsoc, just joining that, getting involved in medicine beyond the actual placements itself, it just shows that medical schools that you have been wanting to do this for a long time, you're very interested, you're not just doing it because someone's forcing you, you genuinely want to do medicine. And then to actually get into medicine, you have to do an admissions test called the UCAT, University Clinical Aptitude Test. It's the same test for medicine and dentistry. There's 4 main sections. There's the verbal reasoning. There's 44 questions, and you have to do it in 22 minutes. So this is just analysing your ability to read through text, pick up different cues in the text, and then just answer questions accordingly. Your next one is decision making, 35 questions in 37 minutes. This is testing your logic. And the decision making here, the logic here is quite difficult. So I would say just practice a lot. There's obviously quantitative reasoning, where it's just testing your math skills, and situational judgment, where they give you different situations and they just test your ability to make the right decision. And that's based on bands 1 to 4 rather than the normal score of 0 to 900. I would say for this, to use Medify or MedEntry, so 2 of the main websites. There's also other ones, but those are the 2 that a lot of people use. I myself use Medify. People might still use MedEntry. It doesn't really matter what you use, just as long as I would just highly recommend getting a subscription to this. And you also want to prepare around 8 to 10 weeks before your exams, before the actual test. And I would say practice very intensely, especially throughout the summer of year 12, where a lot of people just do quite a lot of hours every day just doing UCAT. And the reason that it's so intense is because it's very different to any other exam that you might have done in your life, because it's not like a normal, maths and English test. There's also logic involved. There's also situational judgment, where you're based on your performance in different situations. I think it's such a different test. That's why a lot of people, they don't struggle with it. It's just quite different, and it's a quite unique test. So I'd say just to prepare yourself, give yourself around 8 to 10 weeks of preparation time. And then this leads to actually applying to medical school. After you receive your UCAT score, so you receive it on the day, I would say research after you find out your UCAT score, and just use all your previous factors, so your GCSEs, your work experience, your placements, then your UCAT score. Just research about every single university, every single medical school, about what factors they account for. So, for example, if you have very strong GCSEs and you have a good UCAT as well, try to apply for Cardiff. If you have good GCSEs, a very good UCAT score, you can apply to Oxbridge, you can apply to Newcastle, to UCL, Imperial, the top unis. But I would just say apply strategically, and the most important thing to do is research. Go to every single uni's website. What I did was I made a list of every single university, wrote down how they factor the GCSEs, how they factor their work experience, how they factor their UCAT, and then from there I made my decision based on which medical schools were fit for me from my list. So the most important thing is here is just research and apply strategically to massively increase your choice of getting interviews. Then this leads us on to interviews. most medical schools use MMI interviews, which is multiple mini interviews. This is where there's probably 8 to 10 stations, each testing a different skill, so communication, empathy, teamwork, problem solving, etc. There's also panel interviews. For example, Oxford, Queen Mary, they still use panel interviews, where that's just a traditional interview. You have 2 interviewers asking you a set piece of questions, and you give your responses according to that. The interviews normally take place from November to April, so after you submit your choices, maybe a few weeks after you submit your UCAS, the interviews start to come in. So I would say try to prepare as early as you can for these, and the best way to do this is just to practice with as many friends and with your family, your friends, or teachers. What I did was, me and my 3 best friends, we all applied to medicine, so every day we would go on call for 2 hours, just test each other, and we did that all the way till our very last interview, and it worked for all of us, alhamdulillah. I would say reflect deeply on your experiences. So this is knowing your personal statement inside out, knowing your work experiences, having your just those personalized answers, because it's very easy to tell apart someone that's being very genuine and giving that that actual experience about what happened, rather than someone who's just being very general, someone who just, it doesn't seem like they're in it to do medicine themselves. It seems very ingenuine. And I would also say there's certain things that you should learn from your interviews, so like the NHS core values, your basic ethical principles, and the very common MMI scenarios. And this book in the corner, the IST medical school interview book, I would highly recommend getting that book. Me and my friend, we finished that book. They have a mark scheme, we have loads of different questions which are very applicable to most MMIs. So I would highly recommend getting that book, finish it, basically learn it inside out, and inshallah you should be fine for your interviews. And after your interviews, your offers start to come in, and that obviously means you need to do your A-levels, normally it's a base offer of AAA. It can be A*A at some medical schools as well. But after that, inshallah, you should be fine. So just any questions from anyone? No? Okay.
Thank you very much, Muhammad Abbas. That was quite an insightful presentation, giving us quite a holistic approach on how to go about. Thank you very much. You've been very thorough, and thank you for participating. So next in line we have the second future doctor here, Hira Naqvi. She's a 3rd-year medical student at Cambridge. She has been outstanding throughout her GCSEs with all 9 nines, attaining 4 A-star at A-levels. Hira plays for Wirral cricket team and recently went to Spain for a tournament. And she plays hockey at Cambridge and is also a cadet and can fly small planes. That's interesting. Hira, please welcome Hira. It's very interesting to see and quite motivational for us as well that medicine, going into medical field is not just about studying and being into books, but there's a lot to enjoy, and if people are in their right field and they're enjoying their work, their studies, they can do a lot and enjoy their lives. So thank you, Hira, for coming over. She has come all the way from Cambridge to help us, and let's hear from her.
Sorry, I'm just going to try and get the presentation up. So hi everyone, my name is Hira, and today I'm also going to be talking to you about studying medicine at university. And I will also give another little overview about what the application process looks like and what it was for me specifically. So a little bit about me to begin. I'm 20 and I'm currently in my 3rd year studying medicine at the University of Cambridge. I've then included some fun facts about me. So as mentioned, I play cricket and learning how to fly a plane, and I really enjoy trying out new activities, especially sports. Okay, so if we start with why did I choose medicine, and why might one of you choose medicine? So I think it's safe to say I had some quite strong encouragement from a young age from various unnamed individuals to study medicine. But in all seriousness, there's 4 key reasons why I personally was drawn towards a career as a doctor, and that's what I'll discuss now. So starting with interest, this really began in school. I always knew growing up that I preferred sciences and maths, and so that was the field that I wanted to go into, and immediately medicine becomes an option as a very scientific career path. And then I've also included work experience, which I'll talk about a little bit later as well. But essentially, in year 12, I did a week of work experience in a hospital, where I got to shadow doctors, ask them questions, and see what the day-to-day job looked like. And for me, that was really what solidified that, okay, I know that I enjoy sciences, and I enjoy studying them in school, but actually, as a job, and as a day-to-day job and career, I am interested in medicine. And I would really recommend you go and do work experience in any career that you're interested in for that reason. The second reason here is career direction and security. So, on completion of a medical degree, should you choose to stay in the NHS, as most people do, you are guaranteed to get a job as a junior doctor somewhere in the country. And in terms of specialty training and future career direction, there is a level of security there and direction, and the processes are quite conserved and understood, which isn't necessarily the case for every career path out there. And that was something that appealed to me. Third reason is employability worldwide. So if at any point you are considering moving abroad away from the UK after you graduate, or any point, being a doctor is a really good position to be in because every country in the world has a healthcare system, everyone needs doctors. You will be employable internationally, which can be a bit of a struggle in other careers. And then the last reason, this is the most important to me, is how rewarding a career as a doctor is. So, as a doctor, you meet so many people at all stages of life at their most vulnerable, and you really have the potential to make an impact on them and their lives. And there's nothing more rewarding to me than the idea that I would spend 6 years at medical school, studying and working hard, and then one day, that knowledge that I have can help someone out or save a life. So those are the reasons why I chose medical school and why you might consider them. Also, a note on the rewarding one, me personally, I'm very interested in pursuing humanitarian work, such as with charities and organisations like IMI, as we talked about before. So that's also it's a very good set of skills to have for that sort of work. Okay, and now I'm going to give a bit of an overview of the process of applying for medicine on a timeline. So I don't want to get too much into each of these processes, it's quite complex, and you can go in depth about all of them, but I just want to give a sort of timeline overview, and I've generated this diagram here that's hopefully of some help. So we'll talk about that, starting with GCSEs and the start of year 12. So at GCSEs, I would say the main focus should just be the content of what you're learning, and revising the best you can and obtaining the best results you can. Me personally, when I sat my GCSEs, I had no idea what I wanted to do, and I was not set on medicine at all. Although some people in my life were for me. I'd say where the journey really begins is at A-level choices, as we heard from the previous speaker. So hopefully if you're thinking about medicine, you already have an interest in the sciences and the maths, and so naturally you would pick A-levels that reflects that. Me personally, I did maths, physics, chemistry and French, so no biology. And that's an interesting thing to note actually, as there is quite a lot of variation in which universities specifically require which combination of subjects. And it's worth having a look at beforehand, just to make sure that you're not closing off doors for yourself at such an early stage. The next thing I'm going to talk about is work experience and development. So I talked about work experience before. There's various ways you can go about getting work experience. So if you have any contacts in the field, you can speak to your school, you can reach out to hospitals and GP clinics directly. And it's really an important part of the journey for personal reasons. For me, that was how I knew that this is a career I wanted to do. But also for an application, it looks really good if you've done some experience and you're able to reflect on it and talk about it. And we'll touch on that later as well. I put development on here, so essentially what I mean by personal development is all the things that make you a more well-rounded individual with a better skill set. So whether this is playing a sport, doing some volunteering, signing up to go on Duke of Edinburgh in school, all of these sort of things. And again, they're important for personal reasons, you know, that hopefully you enjoy all of these things you do, and they do make you a more confident, better person in life. But also, from an application perspective, when you get to applying, having done all these things throughout your life looks really good to universities, especially for a field like medicine. So now if we move on to the end of year 12, so you've done a year of your A-levels, and it's approaching the summer. The key thing to think about here is the UCAT exam. So applications open towards the end of year 12, and as we heard about, there's various sections in the exam, and it's all a computer-based exam. And I would say here, the key, as we heard before, the best way to prepare is really doing practice questions, speaking to people at your school who might have some advice, etc. And then I've put choice of universities on this slide as well, so really you can think about this much more in advance, but I put it on this slide for a reason that I'll get to. So choice of university, I've split into 3 elements. The first one being the personal aspect, so would you like to live at home at university? Which cities do you prefer? Have you been to open days? Which libraries did you like the best? All of the personal things that come into it. The second aspect in university choice, and this was a big one for me personally, is the actual teaching. So if we focus on medicine, that's what I'm talking about, various medical schools teach medicine in a very integrated manner. So you're constantly between lectures and clinical placements, and that lasts throughout the entire degree. And then others, for example, Cambridge and Oxford, have a very traditional course in that the first 3 years are preclinical, head in a textbook, studying in the library, and then the last 3 years are purely clinical focused and in a hospital. And that appealed to me, and that should definitely be a big factor in your decision. How would I like to be taught the course? It's a very long time, it's 5-6 years, so definitely factor that in. And then the last reason, which I touched on earlier, is the tactical aspect of applying for medicine, which I think is really important and it's not talked about enough. So at this point, you've sat your UCAT and you've done your GCSEs, you should have a pretty good idea of where you stand as a candidate applying for medicine, where your strengths are and where your weaknesses are. And it's definitely worth having a bit of a research, looking at university websites and seeing what do they value most in a candidate, and making sure that at least a few of your university choices give you the best chance possible to getting accepted. Okay, so now if we move on to talk about the start of year 13, so again we heard about this before, the key thing here is the personal statement and the applications through the UCAS website, which is the website where you apply to university in the UK. So really this is where all of that stuff that we mentioned before about doing work experience and doing sports or volunteering, this is where that all really comes to light and will really strengthen your application, because here's your time to talk about it and tell the universities directly, this is all the things I've done, this is why it makes me great, this is why you should want me at your university. And personally for me, I found that this was the part of my application that my school supported me with the most. So definitely reach out to people at your school, at your sixth form, and get some advice about this. Okay, then moving on, if we talk about the rest of year 13. So the big thing in this period, after you've applied, is the interview offers. So again, as we heard about before, various medical schools hold different types of interviews in different ways. And it's definitely worth, once you start getting some offers in, doing some research again, and having a look at, okay, what sort of interview style do they have first of all? What questions might they ask me? What do the stations look like? How can I prepare myself best for that? And again, practicing with friends through your school, any means that you have available, is a really good way to get used to that sort of being asked questions and being able to give a really good answer. And I think just generally doing practice will get you used to the process of responding to questions that you haven't prepared for in advance, because that will inevitably come up and it's worth being ready for that. And then the rest of year 13, so hopefully you've sat your interviews now and you start to get some offers in. And generally for medicine, this tends to be 3 A's at A-level, although it can be higher at various universities. And then all that's left to do is sit your A-level exams and hopefully get some really good results in the summer and you're off to university. Okay, so the next part of my presentation that I wanted to talk about was sort of what life at university is like. Because I think everyone tells you a lot and gives you lots and lots of detail about how do I apply, how do I get there, and then when you show up you don't have any idea what to expect because no one's ever told you what it's like. So that's kind of what I wanted to touch on now. And I've split this into 2 sections. So I'm going to talk about academic life first, and then the fun side of university, so extracurricular and social life. So academic life, I've got some pictures up here. On the left is a lecture, on the right hand side I've got some pictures of my college library, and in the middle some practicals and experiments that I've done. So the key thing about academic life is the differences, I guess, between schools, which is what we're all used to. So at school, obviously you're taught in lessons, you've got a teacher, there's constant back and forth engagement between the two of you, whether that's asking questions and getting an answer or doing a test, which someone will mark and give you feedback on. Whereas at university it's very different, so you're taught by lectures, which as you can see in the picture on the left, big room of people, lecturer stands at the front, gives you a lot of information for an hour, and then it's up to you to go and find the time to answer any questions you have and consolidate that information. And it's a great way of learning, it's very different, and it's something to get used to and be ready for. And then the practicals and experiments, so again, that sort of is more for science-based medical degrees, very enjoyable part of the process, great way of making friends and bonding with the people in your course. The next thing I just wanted to talk about briefly, if anyone's interested, is the different aspects of studying medicine at Cambridge specifically, as that's where I am. So one thing that was quite interesting to me, which I actually didn't know before I showed up, was that at Cambridge they still do full body dissection to teach anatomy. So that might be something that interests you, and if it is, definitely worth applying or having a look. And the other thing was that Cambridge and Oxford, they do small group teaching called supervisions, in which it's 3 or 4 of you and then one professor or an expert in the field, and it's your chance every week to sit down and discuss any questions you have and really get into depth about the science behind things. And to me that was a really big aspect of why I wanted to go to Cambridge, because I really valued that level of sort of in-depth discussion and really getting into the science behind things. I love understanding things, and that was really important to me. So do ask questions at the end if you've got any questions about that. And then the last bit is extracurricular and social life at university. So funnily enough, I had a lot more pictures of this than I did the academic stuff. But yeah, I mean, this is really the part of the university to look forward to. I don't have a lot to say other than that. There's all sorts of opportunities at university. You can do any sport you've ever heard of, even sports you've not heard of. You can join groups and activities and meet people from all across the country and all across the world, and make amazing friends for life and go on these incredible journeys with them. And it's really the time to make the most of that opportunity. It's a unique time of your life, and you'll grow so much as a person, and you should absolutely look forward to it and try everything out and see what you're good at and see what you enjoy. And up here are just some pictures of the things that I've done. So the hockey team, I've been to lots of very fancy dinners, I've been on trips with certain societies. It's a really amazing time, so do ask me if you've got any questions about that. And speaking of questions, it's now the time for questions, so thank you for listening. And does anyone have any questions about anything I've spoken about today? No? Okay, great. Well, thank you very much.
Thank you very much, Noah. An interesting part of your life. I feel like going to medical school once again. So thank you for sharing all your experiences and all your knowledge with us. I'm sure most of us would have benefited from it. And if you have any questions, Hira is here. All right. Thank you very much, Hira, for your time and coming all the way. So next in line we have Dr. Syed Qasim Ali, who is a dentist by profession. He's working at a private dental practice, a young enthusiastic professional who does aesthetic dentistry as well. Please go ahead on the stage. Let's welcome Dr. Syed Qasim Ali.
Just a few words before Qasim to start. I especially invited Dr. Qasim Ali. He's a very young dentist, very highly skilled, and he's arranging by himself in this age the courses regarding aesthetic dentistry and composite bonding. So just to invite him to see how the dentistry is working to attract other people as well. Thank you very much.
तो जाके उसको बता दो कि उसकी प्रेजेंटेशन है होगा
Asad,
It's fine, it's an issue. With my laptop.
Just connect his own.
It's just jammed.
मासूम इसको कंटिन्यू कर देते हैं ओके
Is anyone here particularly looking at dentistry?
many online, offline, so.
Yes.
नहीं तो इससे कोई क्या कैमरे से क्या करना अच्छा it's his laptop which is not loading his laptop is and he hasn't shared that with us he hasn't shared the presentation वो laptop नहीं चल his laptop जिसको बोलते हैं उसी के उस पर नहीं तो वो उस पर क्या कहते हैं HDMI नहीं कनेक्टेड उसका लैपटॉप जो है उसी के प्रेजेंटेशन में लोड होगा जो सिस्टम मशीन में और उसकी प्रेजेंटेशन वहाँ पर है उसको बता दें तो मैं ड्यू टू सम रीजन इज नॉट वर्किंग बता देंगे चल बसी भाई स्वैप कर देना जो दूसरे प्रेजेंटेशन उसको ब्रिंग फॉरवर्ड करना
Can we email the presentation to Asad? Qasim, if we have technical issues, can we call the next one while we sort this out?
Yeah. Yeah, that's fine, that's fine.
Okay. So while we sort out the technical bits, the next speaker we have is Fahad Al-Sadoor. Fahad Al-Sadoor is a final year dental student on the undergrad entry program at King's College London. Since completing secondary school, he has been actively involved in tutoring and academic research and reflecting his passion for continuing learning. Outside his studies, Fahad enjoys practicing Brazilian Jiu-Jitsu, exploring natural landscapes, and traveling with family and friends. So please welcome Fahad al-Sadoon. Is that it? So Fahad al-Sadoon and Mohammed Hussain, let's welcome them, please. Thank you. Mohammed Hussain is a pharmacist and a final year dental student on the Graduate and Professional Entry Program at King's College London. A UCL pharmacy graduate, he combines expertise in pharmacy and dentistry to advance patients' care and mentor future professionals. In 2024-2025, he contributed to the development of the UCAT SJD, the Situational Judgment Test, which assesses applicants' ethical reasoning and professional values for healthcare courses. Outside his studies, he enjoys football, fitness, travel, and time with family. So thank you very much, both of you. Over to you.
Brilliant. Thank you all for kindly attending today's workshop, and thank you, Dr. Asif, for the kind invitation to give a talk about dental admission. I think you already introduced us. So yeah, my name is Fahad. I'm currently a final year dental student. This is my friend Mohammed.
Hi, good afternoon. My name is Mohammed.
So we'll start briefly by discussing the different options in terms of the different pathways into dentistry, and then go over the different stages of the application cycle. So personally, I applied for the 5-year standard program, and these are the list of the different universities that offer the 5 years program. And fundamentally, the application is based on different components. First one is the academic, which is based on your GCSE scores, your A-level predicted grade, and it's also based on personal statement, which we'll be discussing briefly. It's a 4,000 character text of you describing to the universities why you're a suitable candidate to study dentistry. Admission exam scores, so there's different admission exam scores, but the most commonly used one by university is the UCAT, which was briefly touched upon by previous speakers. And after shortlisting, you might be invited to sit an interview, and that'll be the final kind of stage for the university to shortlist the final applicants who will get an offer.
So, I applied to the 4-year program for graduates. We didn't see many show of hands for people applying for dentistry. If there are any parents here who have children, applying to dentistry, and or they have somebody who's done medicine or pharmacy or even optometry, and they are looking to switch careers, I would strongly recommend dentistry. So the 4-year program, King's College London offer it, University of Aberdeen and Lancashire as well. I won't touch upon this too much, but in your undergrad degree, it needs to be biomedically related. So meaning it needs to have some sort of science component in it, and it needs to be a 2-1 upper, meaning your average grade needs to be about 65%, and it combines year 1 and year 2 of the standard 5-year program. There are also 6-year programs available. That's also available for medicine as well. And so for dentistry, we specifically have 3 different universities, and you need to look at the university websites. They all have different eligibility criteria, and for example, they will look at those that are disadvantaged, or those that are in receive free school meals, for example, and they also assess household income as well. So if you're a high achiever in an area where the sort of average grade among students isn't too high, then you are at an advantage, and I'll strongly recommend looking into this. Also, we don't have any medics here, looking to switch, but there is a 3-year program as well, and this is for those looking to become max fac surgeons or oral medicine consultants.
So just to briefly, we'll now discuss the different stages of the application cycle. So these are the different stages. First, as I mentioned, the academic component, which is your GCSE scores and your A-levels, your personal statement, your admission exam, which most commonly is the UCAT, so working, preparing for it, and then eventually sitting it. And that will be used, of course, by the university to shortlist the applicants. for interviews, then submitting your application for the UCAS portal, and the deadline every single year is pretty much the 15th of October. There's early application in the January application, but for dentistry you must apply for the early application. And then after that, the university will use this information to rank applicants and shortlist applicants for interviews. And after the interviews, you'll hear back for your final outcomes, which generally can be a conditional offer, or it can be a waiting list, or it could be a straight out rejection. So to discuss the first part, which is the component, the academic component, you have the GCSEs, and required subjects by majority of universities tends to be chemistry, biology, and triple sciences. So if you do physics also, it's desirable. Doing math too is also a desirable subject, and generally aiming for a grade range of 7 to 9 is good, with more emphasis on the sciences, of course, because that will give kind of more, strengthens your application. With regards to the A-level, majority will end up doing 3 subjects, and two of the subjects needs to be science subjects. For majority of universities, ideally biology and chemistry. Some universities do allow you to do perhaps maybe biology or chemistry and then another subject like psychology. But the reason why I say ideal biology and chemistry is because that will give you a really good foundation for when you start, because a lot of the stuff you're learning will kind of relate to what you previously learned in biology and chemistry at A-level. And of course, aim for A stars for the majority of your subjects, because that will strengthen your application. Looking at the UCAS portal, you'll see what the entry requirements are, but it's important to kind of emphasize whatever they have on the website tends to be the minimum entry requirements. So of course, if your predicted grades in A-level are higher, then that will only strengthen your application and put you in a better position.
So with the personal statement, our medic colleagues have already covered this quite extensively, so I won't touch upon it too much. But one tip I would share with you is that all of these programs, so pharmacy, dentistry and medicine, they afterwards, after the completion of the degrees, you have to apply for a foundation training program, and a lot of the time it gives you a list of all the requirements, so the person-specific criteria, and it lists all the qualities they're looking for. So my advice would be to look at that first before you write the personal statement.
email kar raha hai presentation
In that statement, what you can do is you
email
can
kar
draw
raha
to
hai
every
presentation
single quality
तो उसको
and
तुम उसमें डाल
consistently write about
डॉक्टर
examples
पास
and
है
how you demonstrate those
शाबाश भाई
qualities,
हमारे
because that's what they're looking for. I've been interviewing for King's College London dentistry applicants, and a lot of the time when I interview students, I do ask about the personal statement. I'm not really interested in why they want to do
इसमें भेज दो
dentistry.
ताकि अभी तुम्हें मिल जाएगी ना
I look
तो
at
तुम
the
खोल सकते हो ना
applicant and
उधर
demonstrate that they will be committed to the course, finishing it, and most importantly, how they manage stress. That's the most important thing I would say. So for graduate applicants, what you can do is, because it's quite difficult to get work experience, what I did was, I just said that I wasn't able to get work experience. So what I did was I booked multiple dental appointments with different dentists, and that gave me a first-hand insight into the way dentists operate, and it also, allowed me to gain an insight into the relationship between a dentist and their dental nurse, which is important because in all of these fields, teamwork is the most important thing. For graduate applicants, your previous degree, your experiences, you should write about that as well. And again, you need to write about how your previous degree has prepared you to, excel in the profession they've chosen, so dentistry in this case.
So now moving on to the admission exam. So we'll discuss the UCAT. There's obviously other admission exams such as the BMAT, but now a lot of universities are moving towards adopting the UCAT. Majority of universities are require applicants to sit the UCAT. So it was touched upon by the previous speaker, but just to kind of emphasize again, it's made out of 4 different sections, 3 of which are graded from 300 to 900, and you get a final cumulative score. And the 4th section is situational judgment, and that's based on they'll give you clinical scenarios and to test basically how you deal with them. They'll give you ethical dilemmas and how you will manage them. And based on your your answers. You'll be then put in get a score between band 1 and 4, 1 being the highest, 4 being the lowest. And in terms of the test itself, registration opens mid-June and it closes roughly mid-September, but it's very important once the registration window opens that you book it as soon as possible so you get a suitable slot. And there are multiple resources that are available, such as there's ones by the UCAT website, which are free resources that will give you marks of the different sections as well as full marks. So it's very important you attempt these before your exam because they're the most realistic kind of representation of how the exam will be. And there are other paid resources such as Medify, which are really, really good for practice too. And in terms of the tips I can give is, as I mentioned, schedule it as soon as possible and allow sufficient time for practicing and preparing for the exam. Generally 6 to 8 weeks in advance is a good time frame. Because this exam is not really a content-based exam, I wouldn't really suggest starting too early because you can get burnt out in preparation and you don't want that to happen before the exam. So 6 to 8 weeks generally is a good balance, allows you sufficient time to prepare and practice and get a feel of how the exam will be. And practice under exam condition. I think what makes the UCAT really, really tricky is the time pressure. As you see here, you have, for example, verbal reasoning, 44 questions in 22 minutes, roughly 30 seconds per question. And you have to read a piece of text which generally is long, and then after that you have to read the question and be able to derive the answer from the text. So that's why practicing under exam conditions and under time pressure is very, very important because that's what makes the exam hard in the first place. And as I mentioned, do not overstudy for the UCAT. 6 to 8 weeks is generally a good time frame for preparation. So based on the UCAT score, and I think one important point to kind of emphasize again, which was discussed by previous speakers, applying it strategically. Some universities will put a lot of emphasis on the UCAT, some will put a lot of emphasis on your grades. So when it comes to the UCAT, if you end up getting a low score, so average score of 640 and below, there are a few universities that put less emphasis on the UCAT, and that's why it would probably be a best decision to apply to these because it improves your odds of getting an offer. And an example of that is Queen University Belfast, Cardiff University, and University of Dundee, and University of Liverpool. There's more emphasis on other components of the application, and that's why if you have good GCSEs, good A-level, help balance out your score and put you in a much better position. It's also important to kind of note, because a lot of times people are focused on the score itself without actually considering situational judgment. Situational judgment, if you get band 1 or band 2, it can put you in a really good position. Specifically band 1, if your overall cumulative score is not as high, but you get band 1, it kind of helps even out. And there's a lot of universities that put a lot of emphasis on their SAT, such as King's College London. And a lot of universities, if you end up getting a SAT score of 4, or even sometimes 3, that can be considered a automatic elimination or rejection. So it's very, very important that you also practice the SJT and aim to get as high as possible score because it will help even out the overall application.
So with the interviews, there are 2 formats. So you've got the multiple mini interviews, or MMIs, and you also have the structured panel interviews. So with the MMIs, you've got multiple stations, and they're at least 5 minutes long, and there are at least 5 different stations, and they touch upon different topics. And with the structured panel interview, you usually have at least 2 assessors, and it could last between 20 to 45 minutes. So King's previously used to do MMIs, and now they switched to a structured panel approach. What they typically assess, will be the same for medicine as well. So your motivation for pursuing dentistry, they might, give you a social and ethical dilemma. So with dentistry, they always usually ask about social media use, private dentistry versus NHS dentistry, and they do ask you about fluoridation of water. In these, dilemmas and scenarios they give you, you should be able to draw upon the ethical principles as well. So that's very important. They may also give you a scenario where they expect you to appraise information provided to you by the interviewer, and that's quite important because what they're really assessing is how quick you can think and how quickly you can interpret data. Because as a medic and as a dentist and even as a pharmacist, when a patient presents to you with various problems and complaints, you need to be able to start in your head whizzing through the different ways you can solve that problem. They also ask about the qualities and characteristics required to be a dentist, a medic, or a pharmacist. And as I mentioned already, it's important that you look at that foundation training's person-specific criteria first. And also for dentistry, sometimes in the MMI, they might give you something just to see how good you are with your hands. So there are only 3 universities that do the structured panel interviews, so King's, Queen Mary, and University of Bristol. When I applied, I actually had interviews with King's and Queen Mary, so King's one was at MMI before, and Queen Mary was the structured panel. I'll say the MMI is a lot more intense because you see a new person every time, so it's almost like trying to build rapport very quickly in the first minute. If you get nervous, you can make a joke and just try and make them laugh, because then they start forgetting about what they were asking, and then then they've got nothing to score you poorly on. So King's College, we mentioned already, 5-year programs and 4-year programs, very, very competitive. So for the 5-year standard program, there's approximately 900 applications and approximately 120 places available. I think that works out to about one place for about 7 to 8 applicants. And then for the 5-year program, obviously 20 with the enhanced support, and then the 4-year works out about 1 to 15. So it is very competitive, so you need to make sure everything else is very good. UCAS, obviously, every university expects you to apply through the UCAS portal, but some of the information in UCAS, I would definitely recommend that you try and look on the university website and make sure everything matches, and pay attention to the UCAS codes. I'm aware of some applicants who made mistakes with the codes in the past, so make sure you do that. Your 5th option as well, especially if you're applying for medicine or dentistry, your 5th option, you need to choose that very wisely. I know everybody's very keen on getting onto the course, but so when I applied for pharmacy, I thought I wanted to be a pharmacist. I had the grace to do medicine and dentistry, but I wanted to go into industrial pharmacy. But in the end, towards my final year and then practicing as a pre-reg, I decided it wasn't really for me. I still practice as a pharmacist, but I think let me link this a little bit to the personal statement as well. So the reason why I'm focusing on that 5th option is because you might, if you end up going down the route of doing, biomedical sciences or pharmacy or optometry, you can always link that back in your personal statement, and you can say how those courses was a stepping stone into, applying for your real goal. And then, this is just me, kind of expanding a little bit more if you are successful. I don't think you should worry about time. Time doesn't matter in the grand scheme of things. It's only a few years in your life. What's the average life? Maybe about 60 to 70 years old. So it doesn't really matter. But if you do decide that you're going to stick with, pharmacy or biomedical sciences, not being biased, but with pharmacy, the good thing is it will help you, especially with the understanding the medicines. And as a medic, that's very important because you're prescribing on a daily basis. And with dentistry, it just helps you prepare for that patient a lot better. So that's important.
No, I think it does. And so, if you end up getting the offer, in terms of how to prepare for the course itself, I think the most important thing is, of course, being as organized as possible. After you get the offer, there are specific forms that you have to fill out. So doing that as soon as possible within the time frame that they have given. Time management is very, very important. So practicing that early on before the course is quite important, because there's a lot of things you have to kind of juggle during the program. So if you already have your time management from school, from GCSEs, A-levels, then it will serve you a lot. Also, especially if you want to get involved in extracurricular activities during your university years, that becomes even more important. And
professionalism, that's very, very important. Obviously, when you're applying, there is that expectation that, you will be a professional student, etc. But it's very important that what you do in your personal life reflects what you're doing in your professional life. And that is something, even as an undergrad, they do emphasize that quite a lot. So it's important that you understand those standards and standards. We've listed a couple of other things just in general. Honesty, especially as an undergrad, because we had COVID and there was a lot of issues with attendance and holding lectures etc. online. But at King's specifically, they're very, very hot on honesty because students they tend to. I'm kind of sharing the bad stuff, but it's important because you want to make sure that you demonstrate this in every aspect of your career. Does anybody have any questions? Okay, thank you very much for this.
Thank you very much. Mohammed Hussain and Mohammed Sabir. That was quite a industry. Moving on to our next student. So this is, let's invite Mariam Zahra Hagar. So she's a first-year dental hygiene and therapy student at Bard Central London School of Medicine and Dentistry. Also working as a part-time dental nurse. Previously graduated with a first-class degree in biomedical sciences at the University of Northampton, and alongside she completed her dental nursing diploma, and now starting her second degree in oral health at Barts. Thank you, Mariam, for coming over and giving us the time.
Hello. I especially invited Mariam. Mariam just started her dental therapist and hygienist course. Dentistry is quite coming in a big change, and the dental hygienists and therapists, they can do a lot of work like a normal dentist doing. So many people, they don't know what exactly is hygienist and dental therapist can do it. So many students, they can't get admission in dentistry. So this is a very great opportunity if they can join dental therapist course, so they can work like a general dentist. Thank you.
Assalamualaikum everyone. I'm Mariam. I'm a first year Barts London School of Medicine and Dentistry oral health student. And I'm going to be speaking to you guys a bit more about dental hygiene therapy, about the roles within that field, and why I believe it's a really underrated area in this profession. Okay, so dental hygiene is mainly about prevention. So it's a practice of keeping your teeth and gums healthy by regular cleaning and care to prevent dental problems. So dental problems, those include caries and periodontal disease. There is a link between oral health and systemic health. So systemic health is about the whole body. Prevention is there to help avoid getting these problems. So with caries and periodontal disease, those who suffer with periodontal disease are more likely to get diabetes, suffer from dementia, Parkinson's, and cardiovascular diseases. So prevention is actually really, really important, and it should be encouraged by the whole community. With dental therapy, it's an extension of preventative care, so you can also do restorative care as well as that. So that includes fillings, extracted baby teeth, crowns, preparations of baby teeth as well, and dental sealants. So this widens the range of work for the dental therapist, easing the load off of dentists as well. So here I have a poster of the roles for dental hygiene therapy. I just split them into two so that's clearer for you. So hygiene, regular visits, also looking out for oral cancers as well, that saves many, many lives. Personal oral hygiene device, smoking cessation and gum treatment, so that's perio. For dental therapy, that's fillings, extracted baby teeth, perforated crowns of baby teeth, giving local anesthetics, radiographs and performing root treatments of baby teeth. So that extension widens the range of dental therapists as well. Triaging with the dental team, I think this is really, really important. So the article I have on here was the article I was given for my interview at Barts. Essentially, it's about alleviating the patient waiting times within the NHS. So especially after COVID, loads of patients have been waiting for long periods of time just to see a dentist. And I have heard on the news that because of such extensive waiting times, they're performing dental procedures on themselves at home. This is extremely dangerous and it's something we definitely want to avoid. So with the help of dental therapists, the dental team can definitely dedicate tasks and delegate easy procedures that the dentist can easily do to the dental therapist so that they're able to complete those procedures and to essentially get more patients to be seen quicker and easier. And definitely this way the dentist can have more time to prioritise more complex procedures such as root canal treatments, prosthodontics and implants, for example. So this is a bit about me on my journey into the dental world. I did my A-levels in psychology, biology and chemistry, and then I moved on to do biomedical sciences. I did biomedical sciences mainly because I wanted to do research. That was what I was particularly interested in at that time. It was only until my third year of biomedical sciences where I thought, I love biology, I love working with my hands, but I wasn't speaking to people as much. I wasn't working with people or helping people immediately as much. So then afterwards I sat down and thought, okay, what is an area that I can work with my hands? I don't want to be sat at a desk all the time. I can still learn biology and I can help people at the same time. And I thought, the dental field actually encompasses all those things that I really want to do. So I did apply to dentistry in my third year of biomedical sciences, and unfortunately I didn't get in. So then I thought, instead of sitting at home and doing nothing for about a year and a half, I thought I'll go into dental nursing. And in this way I actually it solidified my want and need to progress into this dental field, and I absolutely loved working as a dental nurse. After that, I did my application process through UCAS. I'm not going to speak too much about this as the previous students have already went through an amazing explanation of the process. The only thing I would say for dental hygiene therapy specifically is that there's no UCAS exam, so you don't have to stress on doing any verbal reasoning, non-verbal reasoning. And the entry requirements are less stricter than dentistry, for example. So you don't have to be a complete A-star student. I think it's typically around AAB to ABB for hygiene and therapy for most universities across the UK. So I did my personal statement, I did my interviews. That's all roughly the same as what the previous students said before. And now I am starting first year in my BSc in oral health at Green Mary's. So this is a little bit about the routes into dental hygiene therapy. You can go straight from A-levels, and you do have to have biology and chemistry included in those as well. You don't have to do dental nursing like I did. You just have to have the necessary work experience in a dental practice, shadowing a hygienist and shadowing a therapist as well. It is important in your interviews to say how you reflected on your work experience, not just about what you've learned, but reflecting on what you've learned and why it's important to you and why you want to continue doing that as well. If, say, you're an adult and you've completed your A-levels and you didn't do anything biology and chemistry related, that's okay. You can do an access to a higher education diploma, which is equivalent to 3 A-levels, and that gives you biology and chemistry knowledge needed in order to apply. If you already have a degree and that includes biology and chemistry, you can use that in your application process as well. So here are the benefits of being a dental therapist. A dental therapist can do around 76% of what a dentist can do. So you're not necessarily missing out on what a dentist does. It's mainly the majority of what a dentist can do. The rest of the 24% are more complex procedures. I believe this is a field that is perfect for women who want to work. You can choose your hours really well, and you can choose your timings, so you can still work and still come home and look after your family. The money's good, and we can definitely do more. So you're not doing scale and polishes for hygiene all the time. You can have a mix of different procedures that you're doing, so nothing's boring, essentially. Thank you very much for listening. It was quite a brief overview. Does anyone have any questions?
Thank you very much.
Thank you very much.
Now I would like to invite Dr. Syed Qasim Ali, the private dentist, who is here to talk about his experience and his journey into the field.
Yes, Assalamualaikum everyone. I think we've had a lot of discussion around the dental career already in the last hour or so, with the brothers at the back discussing their journey through dental school, and Mariam discussing her journey into dental hygiene and therapy. My role here to give you a little bit of a different insight today. Some of our young brothers and sisters here who are thinking about going into the career in dentistry will see a different side of dentistry now, the work that I sort of carry out, and I will discuss the pathway that I took to get to a stage in my career where I'm carrying this type of work out. So primarily I carry out cosmetic dentistry. That's where I've honed my skill set, but of course I do carry out general dentistry like in a normal dental practice. So what I do in my day-to-day is a little bit of general dentistry, your standard fillings, root canals, extractions, things like that. But also the area that I've niched down into is cosmetics. So you can break it down into two parts. Number one, I help people gain their confidence back if they are unhappy about the way that they look, particularly to do with their teeth. Then I have developed a skill set, and my education has enabled me to be able to resolve those issues for them and help them improve their self-esteem, which is a very lovely thing to be able to do for someone. When someone comes to you with a complex or insecurity that they have dealt with for their entire life, sometimes 20 years, 30 years, 40 years, 50 years, and then in a matter of a couple of hours you can change their entire world. You can change how they view themselves when they look in the mirror. It is a very, very lovely thing to be able to do, and it's very rewarding to be able to do that. And also, some people are not after cosmetics, but just ability to be able to enjoy and eat better, especially in our culture. The nahadis and the naans and everything that we eat. If you're missing teeth, you're unable to enjoy those things in life. So the skill set that dentistry gives you is the ability to create artificial teeth, and people can then once again enjoy the foods that they would like to eat. So how do I do that? So it is a mixture of clinical and non-clinical skills. The thing with dentistry, in particular cosmetic dentistry, is people focus a lot on your actual clinical skill set, how good you are with your hands. Whilst that is very important, what's more important is your ability to deal with people who come from different backgrounds, have different insecurities, and be able to almost become a counselor for them. And take them through a journey where they feel very insecure about themselves, and then you take them throughout the process to a point where they now feel very happy with how they look, and they regain their self-confidence back. So soft skills, communication skills are very, very important in this field. The actual work that I carry out, the nerdy dental bit, is things like straightening teeth with aligners and Invisalign, teeth whitening, composite bonding, veneers, dental implants. All of these often tied together in big treatment plans. A lot of times people will come with multiple problems, and the brothers before mentioned that problem solving is a very important skill set in any medical field, whether you're a doctor or a pharmacist or a dental nurse or a dentist. And you need to be able to think on your feet and collate all the information that you've learned over the years and personalize that information for the patient that is in front of you. And this is where the skill set comes. The actual, and Dr. Wasi is a very experienced dentist, will tell you the actual dental part is often the easiest part of the job. Doing the root canal or taking out a tooth or doing a filling or doing a dental implant is actually the easiest thing to do after you've honed your skill set over a few years. What makes it harder is working on the teeth, on the people that those teeth are attached to. So if you got rid of the people, our job is very, very easy. But unfortunately, we can't do that. So how did I learn to do this? I think some of the other speakers today, they did a better job than I will about the entry process and getting into dental school or medical school. Getting into dental or medical school is quite similar in terms of what's required for you, and that's why a lot of people often think, are we going to do medicine, we're going to do dentistry, and they kind of just 50-50 about it. The process is the same. You need to do really well in your GCSEs. If some of you are at that stage, you need to do very well in your A-levels, and then to get into dentistry, similar process, UCAT. Now, I am a little bit older now, so I qualified 7 years ago, so things have changed, and the brothers before me would be able to guide you better on the exact specifics, but I can tell you my process was GCSEs, A-levels, then I went on to study dentistry at the University of Birmingham. Then you do 2 years of supervised, well, I did 2 years of supervised training in dentistry and in surgery. 1 year is compulsory if you want to work in the National Health, which almost everyone does, because if you don't work in National Health, you will never have the skill set or experience to be able to work privately. And there are a few exceptions to that. If you come from a family or family friends who are in the dental field, you may potentially be able to get into private dental practice straight away, but it's not recommended. It's recommended that you do your years in the National Health to develop a skill set and develop some experience. And then after that, I worked as a dentist for 5 years, often working 6 to 7 days a week, long hours to be able to develop a skill set and experience. So there is a lot of merit in repetition in everything that we do. And the more you repeat the same procedure, the same skill set over and over again, the more honed your skill set becomes, and the better you become at that particular thing. Why do I love my job? And I would recommend dentistry without hesitation to everyone that's here. I think dentistry is a fantastic career for many reasons. I've touched on the rewarding nature of the profession in the sense that you get to do treatments for people that improves their self-confidence, that improves their quality of life essentially. But there's another side, which is, it gives dentistry as a profession, gives you a lot of flexibility that other professions may not be able to give. For example, I can choose what working hours I want to work. So I am not a mornings person. I don't like waking up early in the morning. So I start work at 10 or 11 o'clock every single day because I like to have a lie-in. Dentistry gives me the ability to call up my manager tomorrow and say, actually, I've changed my mind, I now want to start work at 9. Or vice versa, I can call up my manager and say, I've changed my mind, I want to start work, I only want to work in the afternoons on Mondays from now on. Because as most dentists are, most dentists in practice who are self-employed individuals, we have the ability to dictate what working hours we want to work and what we don't. Same goes with what days we want to work. So I often work on a Sunday because I work in a place where there's a lot of traffic from where I live to get to. And on Sundays, traffic is less. So I work on Sundays and then I have my day off on Mondays. So it gives you the flexibility, once again, for me to be able to say, actually, I only want to work 3 days a week, 4 days a week, 2 days a week, 1 day a week, or 7 days a week, if that's what you want. It gives you the flexibility to go into lots of different things. So when you become a dentist, you have an option. You can either go into a hospital setting, where you work as a hospital-based dentist. Usually you're under training at that point, and you don't have that level of flexibility in that setting because you are employed by the trust or the hospital that you work at. There are advantages to this, such as you will have a guaranteed income, you will have a guaranteed salary, and often you will be in a training scheme where your supervisors or consultants are teaching you new skills. Most dentists, however, I would say 80 to 90% work in practices, whether that's NHS or private. And all of these flexibility, all of these flexible aspects of the job are available to you. You can dictate your time that you want to work, the hours that you want to work, the days that you want to work. You have the option to go into teaching. So as Dr. Vasi mentioned before, I run a dental academy where I teach other dentists aspects of cosmetic dentistry. So you can go into that side of things, you can very easily go into business, open your own dental practice if you have the funds and the skills to be able to manage and run a business. You can go into research if you wanted to, so you can get employed by a university and you can go into research, or you can just stay in clinic, work 9 to 5, Monday to Fridays, as most jobs do. So once again, the flexibility, I would say, is the biggest perk of the job and of the profession, which in my slightly biased opinion, is better than other healthcare professions where you are expected to just follow the instructions and the contract given to you. There's lots of options available within dentistry as a career. But not everything is good. Okay, right now I've done a good job at selling the profession. It sounds like amazing, so if I just want to work 2 days a week the rest of my life, I can do that. But it's not as easy as that. We've discussed that. You're not on a guaranteed salary, so the more you work, the more you earn. So that's why often in your early years of your career, you will be working longer hours to get more hours and more experience under your belt, so that you can then transition into a bit more of a part-time work lifestyle if that's what you want, because you'll build the skill set to be able to now charge more for your services and earn the same amount of money. It is a highly stressful career. It hurts your back, it hurts your neck, your shoulders will hurt, all sorts, because you're in a hunchback position for several hours in a day. You have a lot of responsibility, and the way I describe this to people is you are performing awake surgery on up to 30 people, or sometimes even more, every single day. What does that mean? When surgeons perform surgery, more often than not, the patients are put to sleep. They are anesthetized. They don't have to worry about the patient, if they're nervous, if they can open their mouth very wide or not, whether they're twitching all the time, whether they have certain phobias. The patient is put to sleep and they go on and do their job. And obviously they're fantastic at the job that they do. That's not taking any credit away from them. But the soft skills are not as important. Whereas within dentistry, you perform extraction, surgery, implants, root canals, all sorts of things on people while they're not asleep, they're awake. And mouth is a very intimate part of your body, and you don't like people putting sharp tools and injections in the mouth. So that in itself, if you take away the fact that the actual procedure could be difficult, the actual person that you're dealing with the task of dealing with that person is much more difficult than the actual procedure in itself. The same procedure on 2 different people will be very different based on how your patient is. Are they a nervous patient? Are they an angry patient? And you need to be able to deal with all sorts of people of different ages, from 1-year-old to 85-year-old, to someone that is very scared, someone who's phobic, someone who's young, someone who's old, someone who's very angry as well. And you need to have the skill set, the stamina, and the mental resilience to be able to cope with that. Often procedures, some long procedures, especially in my practice, can last up to 4 to 5 hours. So you have to have the ability to focus on a task in one person's mouth for that period of time. That doesn't mean that you don't move or you can't leave your room for that time. But of course, there are elements of the jobs which are technically challenging, but with experience, things like that become not that difficult, and they're fairly straightforward. But again, I will stress this, the hardest part of dentistry is dealing not with teeth, but the people that the teeth are attached to. So, why do I love what I do, even though there are challenges with it? Because I get to do this on a daily basis for my patients. So, this is a 65-year-old lady, doesn't like her teeth, discoloration, chipping. 65 years she spent looking like this, being unhappy with how she looks. And then in 4 hours, I can take her from the top photo to the bottom photo, and that is incredibly life-changing. In just 4 hours, in half a day, you can change someone's life in an instant. Same thing here, young lady bullied at school, she had big gaps in her teeth, was called holy and all sorts of names, when she was in school. And now she saved a little bit of money that she's able to do something about it. And then in a matter of 1.5 hours, I can do that for her. And that is a very rewarding position to be in, and we often underestimate the impact that dentists can make on your life. Another patient, you can see when she smiles, she shows a lot of gum. she really doesn't like it. You can see that the teeth have gaps in them and all sorts of things. She's just about to get married, mid-20s, the late 20s, and she comes and she says, you know, I can't be looking like that in my marriage photos. It's the biggest day of my life. I need to do something about it. And in 3 hours, I can take her from the top to the bottom photo. That's not to say that this is not to pat myself on the back, by the way. You know, most dentists can do this. And it's to show you the impact that dentistry can have on someone's life. We often, when you don't know what dentistry is about, often think it's a very depressing profession. That you go in, you're in a room with a dental nurse, and there's all sorts of weird smells around in the dental practice of chemicals and things. You sit in the chair, there's loud noises, there's drilling and filling, there's screaming. But in fact, that is part of dentistry, that's not to say, but we're making a move away from that, where dentistry is now becoming quite a luxury thing for people to experience. You often see now dental practices that look more like hotel lobbies of five-star hotels rather than dental practices from 20 years ago. So there is a big shift towards that, the aesthetic and the experience side of things. So dentistry now should be viewed as something that is a experience which can be negative or positive depending on where you work and how good you are at what you do. Another patient is just an example, you know, someone that's really struggled with how he looks, wants to go to Turkey to fix his teeth, but instead came to see us, and then we were able to do that for him again in a matter of 4 hours. So very, very rewarding profession to be in. This is something that, you know, someone said to me, I thought this is very cringeworthy. You know, it's one of those things that you read on Instagram and things like that. But it really is true. It really is true. People say, how could you work 5 to 7 days a week? And how do you not get burnt out? You know, you just said that there's a lot of responsibility. You're working in multiple people, awake surgery, all of that all this time. But genuinely, if you love what you do, you don't feel like this is work. It's actually a lot of fun to be able to do that. And dentistry offers that to you. So I like the stuff that I showed you guys. I do that on a day-to-day basis. I love what I do, and it just feels like a hobby. And I feel blessed by God that, you know, that I've been able to find something that I enjoy so much, and then I still get paid at the same time for doing it. But for example, if you're someone that doesn't like that side of things and you prefer surgery, or you're someone that just wants a very normal lifestyle, you just want to, you know, work a couple of days a week, you have kids to look after, you want to work part-time, you have school runs to do, you know, if you become mother or father, you can you can set your timetable and of your working life to fit around those things, and it's relatively easy. I don't see a lot of students here today, actually most of parents that want to learn about this, but I thought this would be a good slide to tell everyone that, you know, I've recently become a dad a few months ago, so I've got my dad hat on right now, and I would say that if you just work hard for 4 years of your life through GCSE and A-levels, your life will be set for a very, very long time. So just put your head down in your GCSEs. You should be aiming for, again, I'm not an expert on entry requirements, the brothers will tell you, but I'm assuming you're going to need 9s, 8s and 7s in your GCSEs to be able to even be considered for a position. You need a minimum of 3 A's to be considered for a position, if not A star, AA, I think in some schools such as King's College and maybe other universities. So just put your head down for 4 hours and work hard, because the rewards will come later. University life is difficult, it's also a lot of fun. We had a couple of university students as well talking before. But the rewards will come. You will feel like this is a lot of hard work and your friends are having a lot more fun. But then 10 years later, your friends who are having a lot of fun in their teenage years will be in a very different position compared to you who worked hard in your teenage years and now you're in a much more stable position in your life. Extracurricular activities are important, sports, and you've got any opportunity that presents in front of you, just take it. Any extra thing that school offers you, any event you may get asked to speak to younger students in, get involved in mentoring, tutoring, anything, just do it. Because there's one thing I found in life is, if you just throw yourself in everything. Opportunities will come to you. Opportunities you don't even know exist right now will come to you just because you've taken the first step. And if you're nervous about what your friends may think or family may think if you do one thing or another, no one cares. Okay? And it takes a certain level of maturity to get to that point where you realize that. I can tell you now that no one actually cares about what you do other than you. So it's all in your head. If an opportunity presents itself, whether it's volunteer work, helping at the mosque, or anything, just take it. Just take it, because it will open doors for you, and the doors you don't even know actually exist. You need work experience, so you need to. It's very hard to get work experience. It was when I was applying, so I understand. I'm assuming things have only got harder now, but I think you'll be very lucky if you manage to get work experience at a GP practice. You need to network, and it's going to be something that you either ask your own dentist that you go to can do work experience, or if your parents have some family or friends, or you know someone through a mosque or community. That's realistically speaking, that's the best way you're going to get it. If you call up a bunch of dental practices, they're probably just going to put the phone down because they cannot be bothered to entertain. The reason for that, and I used to think, well, what is the reason for that? Like, it doesn't cost you anything, it doesn't change anything for you to just have someone there. There's a lot of paperwork you have to do and things like that. People just, they can't be bothered essentially. So speak to people within the community, within the mosque. If your parents know someone, or lots of parents here today, speak to your network of people. That's really the only way you're going to get there. It's nice to have a variety of experiences. So if you know someone that is a specialist in a particular field of dentistry, root canals, or gum disease, or extractions, or surgery, or something, it's nice to shadow them because it shows that you've really explored the profession. And you need some evidence of manual dexterity, so whether that's... Now, a lot of people lie about this in their CV, and there's no real way to determine that. Now, whether that's cake decorating, henna design, arts and crafts, whatever, you just need to show that you have some level of dexterity. If you feel like you're not a dexterous person, it really doesn't make a difference. Okay, I think everyone, a normal person, has a level of dexterity to be able to be an okay dentist. Of course, the more dexterous you are, then the higher skill work you can do, and there is a niche for that as well. But there's someone that was very. The reason I say this, there's someone who approached me a couple of months ago, and they said, "Oh, I'm not very good with my hands. I don't think I should apply for dentistry." And I said to them, "Anyone can do basic dental procedures as long as you haven't got a tremor." What's life like at university? So I've been out of university for 7 years, so things will have changed a lot now. It's a lot of fun. Okay, you're there to enjoy probably the best few years of your life. So you'll make a lot of friends. It's just the nature of the medical and dental and pharmacy and these healthcare professions is that you have lots of Muslims, you have lots of Asian people from similar cultural backgrounds to you. So if you come from a school where you didn't have a lot of like-minded people and families around you, suddenly you'll find yourself in an environment where there's actually lots of people around you which are very similar to you, come from similar family backgrounds. So it's a lot of fun. You make lifelong friends. The person who I teach with, my business partner, is my friend who I sat next to in my first dental lecture. And we've been friends ever since. And we've set up a business together. It is intense. You'll have long terms, by the way. Most university students have 2 terms. Half of the year, they actually don't do anything. But within dental and medical degrees, you will have terms like school, where you have 1 week, I think 2 weeks for Christmas, 2 weeks for Easter, 6 weeks for summer. They're very much similar to school, so your term times are going to be longer, and you have a ton of lectures as well. We'll skip this part, yeah. So I'm happy to answer any questions relating to life as a dentist, or progression in dental career, or anything of that sort.
Hello. In addition to Qasim, there's a lot of commitment to the dentistry, and he said that there's a flexibility of the work. And I'm telling you, Dr. Mohsin is sitting here. He's the owner of the practice for dental clinic, principal. And when he started the business, so we introduced the 24-hour, 7 days practice. And that was really very beautiful experience, but at the same time we build up the business and we become very famous in the whole country. So very few dentists are providing this service for 24 hours. It's amazing. And it's still working 7 days from 9 to 10. And it's a good business, good money. And if you want, like flexibility, he said that some dentists, they want to finish work by 6 or 5 or 6. But we work late hours and we're getting so much, reward from patients. And the patients move from different part of the cities, but still they coming to our practice because they know we open 7 days. So that's the the beauty. I'm the dentist, that's why I'm talking about. But I've got my wife is medical doctor. But sometimes you think, and she's thinking as well, that the way we work and the hard work she does, and that's sometimes might be she's jealous with me. So that but it's about your own passion, what exactly you want to do, where you can enjoy. That you mentioned that your profession has become your hobby. When you become hobby, it's really enjoyable. One of my friends is a urologist in Ireland. He said, whenever I get bored at home, I phone to this hospital and I said, can you put one patient for transplant or some other operations? And he goes and he said, gradually I do, and sometimes I decide my and I do operations. So it's beautiful. If you feel that your work has become your hobby, you can enjoy more, and you get paid as well. Thank you very much. Thank you, Sana. You can continue.
Yeah. Thank you very much, Dr. Hassan. That was quite a bit exciting industry pathway. So the last speaker of the evening, of the afternoon, with regards to career guidance, is Mr. Syed Mujahid Naqvi. He's the Managing Director of London Student Services. So London Student Services provides a wide range of courses available from undergrad to postgrad. And in case you're looking for a career change or you're bored, you can go for a completely different variety of career pathways. They provide these services across the whole Europe. And the services include from health and well-being to business, art, design, digital technology, business management, digital marketing, and several other projects. So let's welcome Mr. Mujahid and he'll talk about it. Thank you.
Assalamu alaikum. First of all, I'm thankful to Novembet, run by Dr. and all the team. They have invited us and provided opportunity to express and provide our services, what we do. Thank you a lot, and I really appreciate that this is a great network and that this is a great effort from the Novembet and the community to provide the opportunities to the different businesses and people to get connected and get benefited from each other. Thank you very much, first of all. Like my sister already introduced that we are a student recruitment company. We're based in Luton and we recruit students from overseas, different countries in Pakistan, different countries of the world, including Pakistan, India, Bangladesh, African countries, to the UK, United Kingdom, and to other European countries as well. So we have basically different courses. Like in the UK, you can see like the medicine studies quite expensive, and most of the students, even the European students or UK students, they don't have enough resources to get studies from universities, especially the medicine studies, pharmacy, stuff like that. So we have our partners in Europe, including Bulgaria, Romania, and Albania, and these countries, Malta. We have a very world famous university over there at very reasonable pricing for the medicine studies, basically. The price range normally starts from 5,000 to 10,000 euros, which I think very economical. That gives the opportunity to all students, especially for the medicine studies and for dentistry and pharmacy students, to provide them opportunity to gain the world-recognized degrees from Europe and from renowned universities. Apart from this student recruitment, we do like a local student recruitment as well. We have different programs including business management, in computing, AI, nursing, healthcare, and some other courses, accounting, finance, and law for the local students, for local adult students who are living in the UK. And basically, we help them if they want to apply for student finance. We can help them all the routes. We can do the student finance application. We can choose the courses for them. We can suggest the universities. And we can suggest the courses, stuff like that, according to their background in education and work experience, all these things. So our stall is already there. We got our brochures on the table over there. We are sitting over there. We got registration form there as well. Our company is, like I said, it's called London Student Services, and the website is londonstudentservices.com. And you're more than welcome to contact us, to give us a call, to drop an email. If you need any information, especially studying in Europe, related to medicine studies, pharmacies, or other affordable studies. So that's basically the platform, what we get on this platform. And I'm not holding up a long speech today, so this is basically, I just want to introduce what basically we do, what services we provide. For further information, more than welcome, you can contact us at any time. And I really appreciate the day. And I'm very thankful to the Novembet and all the teams and all the audience. Thank you very much for your time. Thank you.
Thank you, Mr. Mujahid. It's great to know that we have different facilities at reasonably affordable rates for different kind of career pathways. One of our career pathway guide, a pharmacist, is here with us. So let's invite her. This is Ms. Surur Abdullah. She's a senior pharmacy care pharmacist at Southwest London, ICB lead mental health pharmacist. And she's a senior GP practice pharmacist for over 20 years experience and has also trained pharmacists acting as foundation trainee pharmacist tutor and designated prescribing practitioner. Thank you very much, Surur.
Yes, assalamu alaikum. My name is Surur Saria. My background, I am a pharmacist. I graduated from UCL over 20 years ago. Just to give you a bit of background so you know how I started. So generally you do need A-levels to enter a pharmacy career if you want to become a pharmacist. If you want to become a technician, there's pharmacy technicians. You don't necessarily need a degree in pharmacy. You can do it through sort of experience, MBQs, other sort of courses that you can enter. So yeah, to become a pharmacist you do need A-levels. They require 2 sciences minimum, such as like biology, chemistry, maths, ones I did, biology, chemistry, psychology. There's quite a lot of pharmacy schools from 20 years ago now. You have Kingston University, is very local. There is Medway, Hertfordshire, UCL, so there are quite a few pharmacy schools. You do need sort of, the normal A star, A's, that sort of grades to enter into become a pharmacist. Once you become, it's a 4-year degree, but once you do finish off a 4-year degree, you have to complete a foundation trainee, which is like a pre-reg year, and you can do that in the community, such as like chain pharmacies like Boots or Day Lewis, or even like Sainsbury's. Or you can go into a hospital pharmacy to do your foundation training. You can do that there as well. So you've got the hospital or the community sector. Once you finish the 1 year foundation training, you will have an exam, normally called a pre-reg exam, and that is taken by the General Pharmaceutical Society. So once you pass that exam, then you will become a registered pharmacist. From this year, all pharmacists completing their 5-year training will become prescribing pharmacists. So this is the first year that you become a non-medical prescriber. This means that you can work straight in a general practice. So we've got quite a few routes. So now we've got community, you've got hospital, or you can work in a GP practice. If you are in a GP practice, you can start prescribing. Normally, you will choose an area that you specialise in to prescribe. For example, my area is mental health, depression and anxiety, but you can do asthma, you can become a diabetes, you can choose women's health, for example, and you can gradually then build on your prescribing. So you can start off by, say, doing the women's health, like the HRT, for example, and the menopause, which is very popular at the moment, but then you can start adding things on, like you might want to do diabetes, you might want to do asthma, you might do that through attending training, courses, doing online program, and also supported, you normally have a designated prescribing practitioner, like myself, for example. You complete a course which allows you then to sign people off to say that you are competent, this person can become a prescriber. Once you do become a prescriber, it will become annotated with the General Pharmaceutical Council that you are a prescriber, and then you can, when you write a prescription, they will check that you are an independent prescriber and you can issue that. So there is quite a few roles in pharmacy, like I said. You can work in the community, and now there is in the community, even community pharmacies. They have now different services that they provide. So I don't know whether any of you have done this pharmacy first, where you call the GP up and you say, I've got a sore throat or a cold. They say, actually visit your community pharmacy because they can give you antibiotics. So pharmacist roles are forever expanding. In fact, probably a lot of us are from like Middle East or Asia, like, you know, when you go into a chemist, they can give you antibiotics and they can give you lots of stuff. And I feel that it's moving that way here as well now. So they are doing lots of pathways, community pharmacy, they're doing sort of hypertension clinics. So where if you have a high blood pressure, you go into the chemist, they give you a machine, they monitor your blood pressure for 2 weeks, and then they can start prescribing by ruling out. Obviously there are certain diagnoses, to make a diagnosis, there are certain criteria they have to follow and guidelines to be able to do that. So we've got the community pharmacy, we've got the hospital pharmacy, we've got a GP pharmacy. So I can tell you a little bit about that because I've worked sort of nearly 6 years in a GP practice pharmacy. So sometimes you probably, when you call again your GP, they say, I've booked you an appointment with the pharmacist who will call you. And again, they can now see you and they can do long-term conditions monitoring, such as like I said, diabetes or asthma or mental health, and they can titrate your medicine. So pharmacist really is a medicines expert, okay? So we know all about how the medicines work, we can support with medication reviews, we can now sort of like, once we do your review, we can check which medicines go together, which don't, which interact and you can't have. But yeah, if you call up your GP practice and say you've got a cough or a cold, they might book you in with a pharmacist who will then see you and prescribe something for you. We've also got, once you've done that, my current role is in the ICB, which is Integrated Care Boards, and this is an NHS role that I do. And what we do is we look at guidelines, we tell GPs, because if you have got high blood pressure, you call up your GP, there's hundreds of blood pressure medications, but what makes them prescribe the right one for you? So there is guidelines that we follow, and we look at lots of different medicines, and we choose which one does the same thing, but safest option, but provides the lowest cost and does the same. So it's part of a review, and then we choose and we say these are the top 5 that you should prescribe, because we look at studies, what medicine goes well for a population health. So sometimes our genes are different to some other genetics. So therefore we say that for this person, this medication will suit them best. What I also do is we manage the prescribing budget for GP practices. So we say this is what your budget is, this is what you have to prescribe, this is how you manage it, this is the audits. We ensure that they safely prescribe, cost-effective prescribing, and ensuring what's right for the patient. So it's not just that you go in and the GP decides whatever medication they give you. They are following guidelines, and we write these guidelines. We look at the research, we look at the materials, we look at that, and then we write a guideline that we tell the GP to follow what medication they prescribe. We also monitor things, for example, like antibiotic prescribing. So it's easy to get an antibiotic, but that increases your resistance. So as the older we get, we might not be able to treat an infection. Because we've been on antibiotics, our body's built sort of a resistant to these antibiotics. So we manage that in the GP practices. We monitor what they prescribe, how much antibiotics they prescribe, and we also put that in a formulary. So we say this you can't prescribe because this needs monitoring. We also do things like, even the dentist, there are things that they have a formulary they have to follow. There are certain medications that they can prescribe and certain things they can't. Okay? So there is a reason behind that, and that is that we try and reduce antibiotic resistance. We try and reduce, for example, coamoxiclav is an antibiotic that is called a broad spectrum. It's like your domestos, but it kills good and bad bacteria. We don't give that as first choice. We give things like amoxicillin first because it's a narrow, but also we ensure that, we do a swab or a test, check which antibiotic you can have and what you can't have. We check for allergies, for sensitivities. So this is all part of a pharmacist's role, is ensuring that the right drug is prescribed for the right patient at the right dose. As we get older, our kidney function gets less, our liver function gets less. So again, pharmacists would be checking things like that. For that age, what we expect, is that dose suitable for that patient? Same with young children. It's very important that we calculate the doses according to their weight, rather than just give it like that. Okay? You have prison pharmacists as well. So there are pharmacists that work in a prison, because again, they need medication management. Some of them might be on medicines that they've been on that we're trying to withdraw or step down for them. Okay, so there's lots of roles. Pharmacy technicians, so there's another role, so if you're interested in, again, so pharmacy technicians, they can support pharmacists also. So they would do in a community, the pharmacy technician would maybe take in the prescription, would check, put the label, check that the patient it's not already on a drug that interacts with it. So then they would alert the pharmacist. They go, look, I've picked this up. There's an interaction between this medicine and this medicine, which might be harmful for the patient. Okay? So they would then get the medicine, check the prescription. There might be a prescription that's not complete. For example, a dentist might have written a prescription without the age for a child. So they will call the dentist or call the GP. They will do all that background work. They will put the medicines together, and it's not just they pull it off the shelf. They do have to check, they have to write a label, generate a label, they have to order the medicines, and also they advise in the community. So initially when you go in and say, I have a cough, you're very likely to be faced by a pharmacy technician who will take that history. They would have done the course, they would know what is suitable for you. If you're a diabetic, you can't have this. If you have high blood pressure, you can't have that. If you are under 12, you can't have certain medicines. So that's what a pharmacy technician would do in a community. In a hospital, their role might be very different. They might be involved in sterile medication, like making like the doses for complex drugs. So there's lots of roles, again, out there for the pharmacy techs. And there's counter assistants as well. So sometimes they support pharmacy techs as well. So we've talked about pharmacy. Why would you want to work in a chemist? Like, why is it interesting? So I would say, for me, I found it really interesting because I found all the drugs very fascinating. How a tiny small paracetamol would actually manage your headache. How does it work? What happens when you take it? Like, you take it through the mouth, then, it starts acting. There are certain medicines that work in the saliva, so just by putting it in the buccal, gets absorbed and therefore it acts. How does it do this? This is things that sort of fascinated me and I wanted to know more about. For example, an IV medication, we call that something that has 100% bioavailability. So when you inject someone IV, it goes straight, that 100% of it goes to the bloodstream. Whereas if we take something through the oral route, goes down to the stomach, a lot of it doesn't get absorbed. So we calculate what the bioavailability of that medication to work. So, there is lots of roles out there if you are interested. Also, there is pharmacists in, obviously, education, like I said. So you will find pharmacists working in universities, doing research, looking at new medications, like this COVID jab, for example, that's recently come up on new cancer treatment. So they'd be working and researching and working in the industry as well. You've got industry sector like GSK. So there is lots of avenues, and you have the option of doing a full-time, part-time, especially for somebody that wants to or has children. You can. It is lenient in there. Very, very rarely you get sort of like, unless you're working in the hospital, you might do night shifts and stuff like that. But generally, it's just sort of a day job, a pharmacist job. We've got pharmacists, for example. My sister-in-law works in NHS 111. So when you call 111 service, again, a pharmacist might pick that up. And you might end up speaking to a pharmacist because some query might be, I've run out of medication, I've injured myself, can I have this? So again, they can look and support in those areas as well. Weight management, so now there is a lot of online services. You've probably all heard of Mounjaro, the weight management drug. So again, you'll have pharmacists that, when you fill out your form online, they will take that form, they will check, they will look at your records, they will ask for your weight, they will ask for what other conditions you've got, so not everybody can have it. So a pharmacist would be checking if this medication is suitable for you. So again, if you want to work from home, you can do that and do these online services that are available, but you do need a pharmacist to assess that eligibility to be given or not. So lots of opportunities. My role is I also train other pharmacy students. So I do it in Guildford University. Once a month I go and I train. Remember I said you will need your final year is called your foundation trainee year. So we go and we have OSCEs, which are sort of like short little role plays that they come in and we assess them and we teach them ready for the exam. So we show them sort of a prescription. We might bring in a patient, actors, saying things like, I have a cough, but have they asked for the right questions? Have they had, we support with that. So you can actually become, once you've graduated and you've been on the register for 3 years, you become a foundation trainee pharmacist supervisor. So you will supervise another pharmacist to become a pharmacist on the register. You can work, there is something called genomics. So this is very new hot topic now. So we work, for example, why does a particular antidepressant, we've got lots of antidepressant, but why one works for one patient but it doesn't for another patient? So we now look at things like the way your genes are and which medicine, sort of according to your genetic, will work better for you. So this is very much expanding because a lot of patients, it might not just be that this antidepressant works for them, but they're coming to the GP practice and they bring these reports because they've gone to a private place that says it, and they say, this is the antidepressant that would work for me. And this is ideal for us because antidepressants, for example, when somebody's quite depressed and they're not eating, not drinking, not being able to do their day-to-day activities, antidepressants normally take 6 to 8 weeks to start working. So can you imagine going through 2 months of taking a medication and it still doesn't work? So if we know according to their genes which one's going to work best for them, we're going to achieve results quicker. And also, for example, there is a drug called clopidogrel. It's an antiplatelet. So people who have had a stroke, they take this because it ensures there's no blood clots. So there was people, a study was performed, and it actually showed people in South Africa it didn't work for them. And they actually sued the drug company saying, you gave us this drug, but you know, the whole country did, saying you didn't put it in the leaflet that it wasn't suitable for our nation, for example. So this is a new hot, like I said, area genomics, and you can become a pharmacist if you're interested in using these. It's looking at your genes and which medication works best for you. I think that's it. Any questions?
So when you talk about genomics, are you talking about precision medicine?
Yeah, like all the, so basically.
Sorry, my question was a very interesting thing about you said just about genomics, which is a new thing that's coming up. And in fact, targeted medicine or precision medicine.
Yes.
So as a pharmacist, you work with a group of geneticists.
We actually know, we get the studies, so they might have, the drug company now actually, because they now have to include in the patient information leaflet if this is suitable for, say, white people, for Asian people. So it's a new thing that they now have to include whether this would work for you. So they do this study, they have to do this, the drug company has to do this study, and they would normally have pharmacists on board to do this.
Do you know any universities who are doing it?
At the moment, there's probably, it's very, very new, but I bet there is, yes.
It is absolutely new.
Yeah. So we have to now put, like the integrated care boards, the NHS, so each area for South West London, for example, we have a position statement on genomics, because when you go to a GP practice with a report, does the GP know what to do with this report?
You can solve my problem. I'm currently writing a book for Springer on medical education, which is what I feel. And one of the topics is this, genomics and precision. I can't find the right one.
Yeah. I've got a lot of information. I've got some new information on this. I'm happy to give to Dr. Wasi to forward to you.
Because I found somebody who's working in the NIH.
Yeah.
It's student from with PhD in genomics.
Yeah.
And he's working in NIH.
They will be very needed at this time. It's a very hot topic.
Yes. So actually, I looked around everywhere. 52 chapters. I found all the articles, not on this particular subject.
It's actually, so the 10-year health plan work plan from the NHS was out a few months ago, and genomics is in it. So it's part of this 10-year NHS plan.
Thank you so much.
Yeah.
Hi, my name is Dr. Bassi also. Genome England, we started working with Genome England
Yes.
on hepatitis for GLP-1s.
Yes.
So this is a hot topic again
It
for
is.
GLP-1s.
Yeah.
So this is again coming more and more in certain disease where we don't know. There's a big small residence or certain population, nobody knows exactly what it is.
Yeah.
So Genome England is expanding this.
Pharmacogenomics is expanding.
Each topic by topic and class by class to see which drug and certain.
Yeah.
So we're working with Genome England already.
Yes.
So I work for Eli Lilly. I'm the GP lead for that.
Yeah.
So we're working with them. They reach out to us to work with us to understand the stuff.
Yeah. Actually, I just wanted to follow up on what here. So basically, new drugs like the Mounjaro, when they come out on the market, they are under MHRA. So this is something very important. We monitor these drugs for say 5 years because these are just new. We need to know, so if you report a side effect or a sensitivity, it goes on something called a yellow card reporting. So we have to, because we don't know what this is very new, we don't know what the long-term side effects of these are. And at the moment, it's, every time you report something, your GP or pharmacist would have to fill out a yellow card, which goes to MHRA, which is like an agency that monitors the safety of these medicines, and then they will collect this information. So in 5 years' time, so recently the GLP-1 that doctors just mentioned, which I like, Mounjaro, Wegovy, semaglutide, there is a new study that showed they increase the risk of depression and suicide. That is, you know, it's forever. We have to look into this, and then in about 5 years, then decide if, you know, all of these. So when a new drug comes out, any sensitivity, any side effect that is significant, we have to report it through that way. Any other questions?
Thank you very much, Dr. Singh. Just a reminder that we have raffle tickets, £2 per ticket. You can buy as many as we have some winning prizes on them. So it's like the free Invisalign consultation by Paul Dental Clinic to professional orthodontists. We have teeth whitening, electric toothbrushes, and water flossers. So please go and get your raffle ticket as the event ends. And thank you very much to all the speakers. Now I would like to invite Dr. Shabi Zedi onto the stage. Briefly about him, he's an ENT surgeon with the NHS UK and founding Chancellor of Southern International Virtual University. He's a former president of Imamia Medics International and has held distinguished academic leadership roles as a professor, dean, vice chancellor at renowned universities like Dow University, Sindh University, Pakistan, University of Saints, Malaysia, and Fatima University. A prolific writer, ethicist, and speaker, Dr. Zedi recently published an encyclopedia of Islamic medieval ethics and is currently co-editing, as you mentioned, the modern medical education for Springer Nature with Professor John Sanders at Edge Hills University, UK, and Professor Ali Nasser, Mount Sinai, USA. He also leads professional training programs in health professions education. Dr. Zedi is a great author and editor with more than 30 peer-reviewed publications covering variety of medical topics, including bioethics, medical education, and healthcare justice. One notable work is the Encyclopedia of Islamic Medical Ethics, and his message emphasizes the evolution of knowledge in the digital era and the importance of open learning. Let's join hands together to invite Dr. Vasile. Yes.
Well, it's been a wonderful, great experience. Thank you for inviting me, Vasi. I was looking forward to a program like this. So I'm a humble student, a lifelong learner. I'm not a professor or anything, whatever's been described, but I'm an author and a writer, and also I run these short courses, online courses, and I welcome all of you. I'm so impressed with the talk that I've just had. The best part was that to be a dentist, and which I promise I will be in my next life, I can make more money. That's the best part. But all the talks have been wonderful, educational, great learning experience, and whatever. So many years ago, I established a medical school in Barbados for a certain group. And the reason was that Imami Medics International, a lot of parents were struggling to get admissions for their students. Admissions in the UK or USA. USA is even worse. UK is bad, and I have two grandsons who are studying in Imperial, so I know the experience what they've been through. It's very difficult. And I realized that the answer to this dilemma is that we have to look at the reasons why everybody wants to go into medicine. I visited Imperial day before yesterday and St. George's recently with my grandsons. I could not find a door there. Not a single door in the practice floor. Why? So we have to find to look for the reason. When I was studying here in 1968-69, I was the only person in Edinburgh with an Asian background. Something has changed. There is some kind of shift, a paradigm shift. Is it the reason is that it's a lot of peer pressure, parental pressure that goes into medicine and dentistry? Because accounts, finance, banking, IT, I mean, I have a nephew in IT who makes more money by designing his apps, etc., than I could have ever done in medicine, doing otolaryngology, hearing, etc. Rihan is a good example. You should follow his example. He's the owner of an TV company and what have you. So there is a reason for doing it. I think one of the reasons is that we don't go into medicine or dentistry for making more money. We want to go into medicine and dentistry because we want to serve humanity. And I'm not saying it's like a problem. That is the reason I went into medicine, because my nana was a doctor, my family full of doctors. I learned that the best thing they did was serve communities and humanity in different areas of the part of the world. And that's exactly the reason. I'm very impressed with the level of conversation, debate, discussion, and the guidance. And I think such programs are important. Momineen Medicine International is your organization. And I think you should all join in. And we're holding a conference in Iraq, in Karbala, from 22nd to 28th of December. I'm going, a lot of people are going. Come over, join us. There'll be a lot of programs. My final advice to youngsters is that if you want to stay in this country, be very precise, know exactly what you're planning to do, not get misguided. But if you want to go into super specialization, like cardiac surgery, or cardiac thoracic surgery, or like genomics, etc., go to America. This country has no money for research. I'll give you a practical example. In my whole lot of community of people I know, Asra Raza and Naveed Sayyed, they are the top scientists. They are sitting almost at their level of Novembet. Asra is a professor at Columbia. Her book recently came out with the first step. And it's amazing what she does. But when she came over here, we had a meeting at my house, lots of people come. She said exactly this thing, that people approached her from UCL, etc., they joined us for research and in cancer, etc. She said, you have no money. Because in one project in America, I mean, she had a grant of $45 million. I know one of my old students, also my relative, Mahmoud, is a professor of neurosciences in Duke. And for one little project, he gets $20 million. You can never think of such things yet. So the message is, if you're extra bright and you want to do something extraordinary, etc., go to America. Very simple. But if you want to live like humble, decent, good quality life, buy a new car every year like was here, buy a new house like Rihanna was here, this is a good country. It's a comfortable country. I mean, it's such a good country. Within 4 hours you can cross the whole country, drive. In America, I used to travel, my son was doing medicine there, not a terrible professor in Mount Sinai. To go from New York to Hershey, Pennsylvania, it takes 6 to 8 hours. So it's very good. Thank you for holding this wonderful meeting, and I'm humbled to be here. Thank you. And the certificates.
So if you can please be here, so we'll invite.
You should do that, Sana.
They would be honored.
She's a rich lady because her husband is a big banker.
Rich is a big word. So thank you very much for all of you for coming here, supporting the community, and I would like to especially thank Surrey Momineen for organizing the event and Imamiya Medics. It was a great learning opportunity, I'm sure, for all those students who are here, and of course the parents who have the phase of anxiety where their children would be going in their career pathways. So a great event, and thank you all for coming over. Now it's time for distribution of certificates, and we'll start with Hira Mehdi. I suppose she has left. Okay. Okay. Najat, if you can please come and take the certificate on her behalf.
Yeah. So, his father-in-law was my niece in Paris for many, many years. And he was a strong, he was so brilliant at
Thank you. Sarur Abdullah, please come. Sarur, please come up.
Thank you.
even stronger energetic round of applause. Yeah, thank you very much. Yeah, so next is Mariam Zehra Haider. Please come over. Yeah, that's right. Next we have Mohammed Hassan. Please come over.
Mohammed Hussain is the physiotherapist, and in the 11th hour we called him and he has no presentation. He said, I'm sorry that you very short time, but so he's my friend Nadeem, Nadeem's son, I would like that people must understand about this field. It's a very good field. If somebody wants to get information, so please talk to him. He just recently completed his course and having practical. Thank you.
Shazman is here with us, if anyone would like to talk to him and explore more options about it. So next we have Muhammad Hussain. Please come on the stage. And it is Dr. Fahad Al-Sadoud. Energetic round of applause, please.
Are you related to Ali Sadoun, Dean of Life Survey? I'm going to see him. He's the coordinator for
And last we have Dr. Syed Qasim Ali. Please come.
I like to approach work 0 hours in that maximum.
Thank you very much. We don't have any further plan because the first one is the deep fighting.
I didn't invite it. Of course, please get me 3 tickets. Just clear them off for me. And anyone who has not taken and would like to grab one, please take it because we are going to announce the prices. We can wait for a couple of minutes. Please go ahead and
The Foreign Clinic is providing free consultation for Invisalign. If somebody is interested, let me know. And the teeth whitening gift is came from the Foreign Clinic as well. So,
Please go ahead, please get me three tickets.
and I'm very sorry that my speakers are so good and very selective.
I definitely need
And I don't know, so many people register, they don't come, and they miss this opportunity to listen and talk to these people directly.
So it's £2 per ticket, whatever.
This program will be on internet as well. So if you can talk to other people who miss this opportunity to come here,